99211 we often hear referred to as a nurse visit, although it's not always just for nurses. The official definition is that it is an office or other outpatient visit for the evaluation and management of an established patient that may not require the presence of a physician or other qualified healthcare professional. Today, let's talk about those level 1 office outpatient visits. By the way, I'm Victoria. I'm a medical coder, auditor, educator, and content creator. And on my channel, I provide tips, tricks, and tutorials to help you be successful in a medical coding career. If you haven't already, highly encourage you to subscribe, hit that notification bell so you can get alerts when I post new episodes. Now, one of the questions you may be asking is, what happened to 99201? Isn't there a level 1 new patient? Well, there really isn't a lot of new patients that come in for a very minimal problem that wouldn't necessitate seeing a physician. So January 1st of 2021, they actually eliminated the 99201. So the lowest level visit you can bill for a new patient for that practice is actually a 99202, a level 2 visit. Now, if we look at some of the criteria for a level 1, it does get confusing because here it says level of medical decision making not applicable, complexity of problems not applicable, data not applicable, risk not applicable. So how do we know exactly what we need to document for a 99211? Does this mean we don't have to document anything for 99211? Well, no, because even though we don't have the strict requirements of, it has to be this many problems, we still have to support medical necessity, which means there needs to be a reason documented why that patient is receiving that service. That doesn't mean that we can just throw away the whole thing, that we don't have to document anything. There still needs to be documentation of medical necessity, what happened to that patient, what was the outcome, still the pertinent information of what was going on. So what do we commonly bill 99211s for? You'll see them a lot in family practice settings for things like blood pressure checks or weight checks where they're just coming in and seeing the nurse. You might see them too for things like dressing changes if their patient is just coming in to have their dressings changed by a nurse. So really minor things that we don't have to involve a physician or a physician assistant or a nurse practitioner. They could be done by an LPN, they could be done by a medical assistant. As long as it's in that scope of practice for that state, for that type of personnel to be providing that service. Now, one of the things that we continue to hear is there's a lot of confusion about billing things like vaccines with a 99211. There's a lot of thought that, they're coming in to see a nurse and getting that vaccine. We should be able to bill a 99211 for that. Let's actually first take a look at the claims processing manual because there's some interesting information here in the Medicare Claims Processing Manual, Chapter 12. So if you look here, you can see that it talks about like chemotherapy administration, and then just this applies to a lot of our vaccines and injections as well. So it says, for services furnished on or after January 1st, 2004, we do not allow payment for CPT code 99211 with or without that 25 modifier, which we'll talk more about 25 modifier, if it's billed with a non-chemotherapy drug infusion code or a chemotherapy administration code. So that's interesting that it says with or without that modifier 25. So let's think about that for a second, and actually let's check our CCI edits and see what they say. So this is our CCI grid, and if you've not watched the video that I have on NCCI edits, you can check that out. I will link it in the description below. And just to go back up, so our 0 is we are not allowed to put a modifier. We cannot unbundle these with any modifier, meaning if this code here and this code here have a 0, we can never bill them together ever, 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 even with a modifier. 1 means that there might be circumstances where we can bill these together, so we can put a modifier on there if it meets those circumstances where we are allowed to unbundle them. 9 is not applicable. So keep that in mind. 0 means they are never allowed to be billed together. They cannot just put a modifier on it to bypass that edit. So when we look at these 99211s, you can see there's a lot of zeros here where we cannot add a modifier on to bypass that CCI edit. So if you look up a lot of our vaccine codes, you'll see here these 90471, 99211 has a qualifier 0, meaning we can't bill that together. 90471 is a vaccine administration. Let's actually look at our CCI edit policy manual and see what it kind of says about the 25 modifier there. If we look at the CCI policy manual from Medicare, it says, similar to drug and chemotherapy administration CPT codes, CPT code 99211, the E&M service office or other outpatient established level 1, is not separately reportable with vaccine administration codes 90460 through 90474. So those are our pediatric vaccine administrations with counseling, and then our adult vaccine administration codes. I have a video about those. I will link that in the description below. And I think I have one about the policy manuals as well that I'll link. So it says that it's also not reportable with the G0008 through G0010. Those are Medicare exclusive administration codes for flu, pneumo, and Hep B. And it says other CPT codes are reportable with a vaccine administration code if the service is significant and separately identifiable, in which case the E&M and CPT code may be reported with Modifier 25. So that's kind of one of the key things to think about. If we're going to bill a 99211 with another service, we would have to put a Modifier 25 on that. And that Modifier 25, there has to be something significant and separately identifiable. And if it's a minor service that a nurse could do, what would be significant and separately identifiable aside from that tiny little minor thing that the nurse is doing? In fact, my Medicare contractor, Novitas, has this wonderful Modifier 25 fact sheet that they put together, which clearly states on here that a Modifier 25 is not to be used with a 99211 service. So you could never bill a 99211 with a Modifier 25 and anything else. Even if we go back to my handy dandy Find a Code, by the way, I love this program. And if you're ever interested in getting Find a Code, it is just so wonderful to get things like the lay descriptions, to get CCI edits, like everything very simplified, very search engine friendly, right there at the tip of your fingers. Just click, 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 and you find it. Even things like having to get more specificity on your ICD-10-CM codes. I love Find a Code for that. I will link below my discount code that you can use to sign up for Find a Code, and you get a great discount. So if we look here at our Find a Code and we try to do a CCI validation between a 99211 and a 90471, it says here there's an edit and that there's a column 2, and that if you try to bill both of them together, they're only going to pay for that vaccine administration code, that 90471. So for a 99211, we don't need the 5 paragraphs of a SOAP note, but we still do need that medical necessity. We need to know why that patient came in for that day, what was the diagnosis that was being treated, who saw them, and what was performed. Just because we have that NA there in our column doesn't mean that we don't have to document anything. We still have to have the documentation that proves medical necessity. And we have to understand that in a lot of cases, we can't bill it out with something with a 25 modifier because that tiny little E&M is probably going to be built into whatever other procedure or service is being done. All procedures have a little E&M component built into them, even a vaccine administration. It's understood that if you're seeing a patient, even to do an injection, that you're going to do a little bit of history. You're going to do a little bit of an exam. You might ask them maybe if they're having a fever that day. You're going to make sure that they're not allergic to eggs if you're going to be injecting them with something that might have an allergic reaction. So that little intake of history and exam is all built into the procedure code itself. Now, my last recommendation with 99211 is also to look at some of your payer guidance, because some of them do give you examples of, yes, here are some situations in which we will cover a 99211 and situations where they won't cover a 99211. So check with your payers as well to see if they have any examples of circumstances where they will cover it. For example, those weight checks, those blood pressure checks. I hope you enjoyed this video. And by the way, if you want to hear more about CCI edits and me talking about the policy manuals and how to navigate CCI, this is the video that you want to check out. I will see you guys in the next video. And until then, just keep on coding on.